I also saw that you do some EMDR as well.
Yeah, we both do EMDR.
Yeah.
I actually think almost everybody in our practice is EMDR trained. I'm an EMDR consultant. She's about to be an EMDR consultant. So we've been working our way steadily
Yeah.
toward getting that certification.
It's been a bit of a theme lately with the topics we've been talking about on the show, because
Oh, yeah?
we just did our in-person event and we had the three ladies on, two of which were EMDR trained and talking about a lot of trauma treatment.
Yeah, EMDR, actually had to wring my arm to get trained in
I
EMDR
forgot about that.
years ago because
Yeah.
I came from more of a cognitive-based trauma approach. So I used CPT, cognitive processing therapy, and she told me about EMDR. And I said, that sounds like some hokey pokey, like
Yeah.
that doesn't make any sense to me. So I was a huge skeptic. And then I got trained, still remained skeptical until I started using it. And I love it, and I've used it personally. So
The question I always ask with EMDR, especially when I have the clinicians who do it, I always ask, are you a light bar person? Do you do the tapping? Are you a hand person? What type of EMDR are you ladies?
I'm a tapper.
You're a tapper?
Yeah, I have the little buzzy tappers that go in your
nice.
hand.
I used to use my arm, and then that got tiring. So
Yeah.
I graduated to the tappers.
I
Yeah,
know.
you build
So
up your shoulders.
Yeah.
have to increase our health insurance if we kept doing that one.
Yeah.
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 Yeah. We had a local clinician, Troy Calloway, a couple months ago. He talked about how he has the sound stimulation flowing on the sides of his room. It's interesting to see the different ways people implement the bilateral
Yeah.
stimulation. Yeah.
So in your own practice with therapy, have you ever considered doing EMDR, or do you?
It's been kind of touched on with supervisors I've had
Yeah.
over the years. I had a supervisor who really thought, and I kind of resonate with this, that I'm more suited for like somatic work. Most of the groups that I would do, I just had a natural affinity for that.
Gotcha.
In my practice currently, I work with mostly 12-steppers, and mostly the family members of alcoholics, and there's a lot of somatic work to be done there.
Sure.
Especially with like the recent research on ACEs that have come out that show like they're coming in with stress-related symptoms and no one knows why, and it's a lot of that, the somatic symptoms, like what they're storing in their body.